Good morning, everyone. So today we have our student, Dr. Kavin Sugumar, and he matched completely in general surgery. So a lot of you have been asking, what does it take to match in general surgery? What are the challenges? And as an IMG, what all can you do? So here he is, and we want to pick his brain and understand what it takes to match in general surgery. So Kavin, welcome, and thank you very much for sharing your thoughts with us.
Thank you so much, Dr. Kara. It's a pleasure to be here.
Okay. So let's start off briefly with your journey. Your med school. I know you had home country residency. So walk us through all of that so that we can set the stage.
Sure. So I am from India. I did my medical school. That's a five and a half year training, and then I did 3 years of general surgery residency. All of this was in India, and associated with our residency, we had a 1 year bond. So I had finished that. So it's totally about 9 years. I did all of my training for 9 years, and then
Wow.
following that, I mean, me and my wife, we both wanted to come here. I think the main reason and the pushing force for both of us was actually research. We wanted to have academic careers, and we just wanted to come here. So I did some research for about 2 years, and I just recently matched this year.
Yeah. So now let's switch gears and you've been through such a long journey starting with MBBS. Uh, what does it take if you were to just summarize? What does it take to match into general surgery for an IMG? So important things that you have seen. What are important? You mentioned research. What are some of the other things? Maybe scores. So what has been your experience?
So yeah, absolutely. So I think this is a question that everyone really wants to know. So I think you can break this into three different parts. So first, I think you need to know what to do exactly to match into the specialty. I mean, yes, I agree that medicine pediatrics are becoming more competitive, but for this, I think you need certain perks that you want to get right before you start your preparation.
Okay.
So for that, you need to reach out to everyone you know, everyone you don't know. Reach out to them on social media. Reach out to them via their website. You need to do your research and try to like figure out what their experience was and how they did it. So once you have all this jotted down, I think the second step is just hard work, just sitting down and getting stuff done, doing it, be it electives, be it observerships, be it research. I think buffing up your CV on all of these three fronts, research, volunteer activities, and electives. So just buffing that as much as possible. Is there like an upper limit for this? No, definitely not. I mean, the more you have, the better. And I think this will take the most duration of time. And I think the third most important step is the finishing touch, is how you package that all into one application. I mean, you can have 10, 15 publications and you can match, and you can have 5 publications and match. I mean, it all depends on how you package your application too. So I think that's where Sarthi came in my regard. And I think that will definitely will help everyone in their match.
So let's talk, step by step. So scores, general surgery, how important are scores?
Scores are important, yes. I think now for every specialty, it is becoming more important. Yes, it is. I mean, having anything more than 240 is definitely considered competitive. I've spoken with a lot of people here, and I think they consider anything more than 240 as competitive.
Okay. What about, so did you do electives as part of your MBBS? But they must have been long time ago, right? But you did do electives?
So Dr. Kerr, I will have to let you know that I did not do any electives after my
Okay.
MBBS. I did not do anything. So unfortunately, when I decided on coming here, all I was left was a couple of observerships. But
Okay.
I mean, it was difficult to get an observership here in surgery. So I did about 2 observerships. Really got really amazing mentors. So I mean, even though I wasn't able to do any hands-on experience, I still got some mentorship and some kind of experience from the entire medical system here.
So looks like in your case, and maybe this is the path a lot of students follow. Good scores, home country residency, and then US research. So looks like US research was also central to your plans.
Absolutely. So I think the most heavy part of my application was actually research.
Okay.
So which I think was the most pivotal step in the entire application process. So it helped me to reach out to a lot of great, amazing people here in the US. Really, I mean, who are really want to help you out, and
Okay.
you just need to show them that you can do a good job and you're reliable,
Okay.
and at the same time be honest. So I think if you just get those simple steps right, I think you will definitely, I mean, get a really good letter of recommendation. I mean, and to add to that, you will have a mentor all throughout your life, and they will definitely follow you.
Okay. So, and research tenure has to be substantial. I mean, I think you said you did it for what, 2 years, 2.5 years?
Right, absolutely. So it was for 2 years.
Okay.
So I mean, if anyone asks me, I mean, is research required for surgery residency? So what I will tell you is that there are two pathways. So the first is suppose you've just finished your medical school and you've done a couple of electives.
Mm-hmm.
I would suggest, if you are planning to go a categorical route, I definitely do research.
Okay.
Um, but if you want, I mean, if you say that, hey, I really don't like research, I just want to jump into residency training. I mean, you can apply. You have a good chance of matching into a mid to lower tier program as a preliminary resident,
I see.
and unfortunately, it is a very competitive thing. Even after you get a prelim position, it is very cutthroat, I have to say. And definitely, I mean, I have not been through that, but I mean, the people that I spoke to, I think they gave me that kind of picture. But yeah, I mean, like, you have two different pathways. I mean, it really depends on what you want to do. If you want to spend time doing research, I would recommend doing it for at least a year,
Yeah.
and getting a few publications, few presentations, and I think that is very important.
Okay. Now, coming back to your journey, what were the major challenges that you faced? Was it ever year of graduation, or what were the other challenges you may have faced?
So absolutely. So I think the most important thing that I faced initially was, after finishing my residency, I had to do step one and step two again, which was very difficult. I mean, it was. I mean, I think without my wife and without her support, I think I wouldn't have been able to do that on my own. I mean,
Mm-hmm.
I used to have a 24/7 learning or study partner that I could just, like, I mean, like, went out, or I mean, like, read together. So I mean, that was very difficult. It took me about almost a year to finish all of my steps.
Okay.
And I did my step three also. So that was
Wow.
also very important.
Okay.
And I think the second most important um, ladder that I had to climb, and which was very difficult, was actually finding a research job. So
Mm-hmm.
it involved in emailing a lot of people, a lot of research to find out who are interested in doing research. It took me about 6 months to do that, but I mean, I had to take multiple interviews, because I mean, you're applying to a research position and you have no research experience.
Right.
You don't know statistics. You don't, I mean, apart from a few case reports, you really don't have any research experience when you start off, and you're trying to sell yourself and say that, hey, I'm going to do cutting edge research with you for another year or two. So I mean, it's like you're asking for the ocean when you just have a drop. So um, so I think that was I think the most difficult part of my entire 3 years.
Okay. Now, just one more question before we move on. Uh, does the home country residency and the med school brand, these two things, how important are these? Was home country residency a big deal?
So yes, I mean, in the places where I interviewed, yes, I think definitely they did see that as a positive. Yes, definitely. I mean, in a few interviews, I was actually. I mean, they even asked me a couple of questions that only a trained surgeon would know.
I see.
So just to assess whether you're really trained.
You did it.
So So definitely, it is definitely a positive. I mean, yes, you are limited from some programs because of graduation years, but at the same time, it is a strength if you consider it to be.
Okay, okay. And does the brand name of your MBBS or residency, does it matter in these applications? Did they know? Did they recognize?
I mean, yes, if you have alumni from the same place, yes, it definitely matters. If you have attendings or pass outs who are from the same place, yes, it definitely matters. It really pushes your application through. Yes.
Okay. Okay. Now, talk to us when you were saying, packaging of the application, interview prep, and all. How did you go about it, and how was our team helpful to you?
Absolutely. So I actually joined Sarthi just before I think the ERAS application started. So, I mean, even though I had I mean, comparatively a good CV at the time. I mean, in terms of publications, I had about 3 to 4 publications over the last year before applying. So, but I was still very much underconfident on exactly how to put it together and really, I mean, whom to email, how to make yourself seen to programs. And I think the videos from Sarthi were really amazing. The panelists, I think they did a really great job of explaining stuff. I think you can really ask a lot of questions. They're really interactive sessions where you can ask questions that you really, I mean, you can't ask anyone else, and they'll give you an honest answer, which is I think very crucial because I mean you don't want a buttered coated answer. You want the truth so that you're better for the interview. And also, I mean, apart from interview prep, I think post application outreach, how to email and keep the program in the loop, how to write emails, how to communicate with them, what to do in this instance and that, and various scenarios. And so I think that is very important because in surgery you want to tailor your application for various institutes. So in that instance, I think Sarthi was I think instrumental in my match here.
Thank you. Okay, so as we wrap this up, what would be your tips to other applicants who may be interested in general surgery? And I know you mentioned those two paths, prelim year versus categorical. So, what are some of your tips, suggestions for other applicants?
Absolutely. So I think number one is that you need to make your decision of taking up surgery, and you need to be confident that you will be able to do it because it is a difficult path. But
Hmm.
I mean, I think once you make up your decision, I think you should be able to do it if you put in the hard work. I think there is nothing more than hard work, and I think reaching out to people, I know a lot of people that I reached out to and really were, I mean, almost as angels when they helped me out. I mean, because people have been through this entire process. They know how difficult it is, so they are willing to help. And I think all of this together, I think helps you to get into surgery residency. It is difficult process, but I would suggest reaching out to people and finding out what pathway you want, whether you want to do an prelim route pathway or the categorical. So I've seen people succeeding on both. I
Hmm.
can't say which is better. I mean, it all depends on what you want to do. I mean, if you like research, go ahead, do research. It adds to your CV. It helps you to get into a competitive fellowship. But if you just want to do intern year, you're not really interested in research, I would just suggest do your electives, get good scores, get a few case reports, or I mean, whatever publications that you can get your hands on, and I mean, I mean, start today. I think.
Yeah. Well, thank you very much, Kavin. This is very helpful, and I'm sure this will help all the budding surgeons who keep asking, how to get into general surgery, and also much appreciate your time.
Thank you so much, Dr. Kara. It was a pleasure talking to you again.
Thank you, thank you.